Imagine being the caregiver for a teenager who, when frustrated, throws chairs, physically assaults others, despite trying all kinds of therapy, family therapy, individual therapy, all kinds of medication classes. Or picture a young adult who hasn't slept in days and is convinced their neighbors are spying on them. In moments like these, the right medication can feel like a lifeline. And for many, Risperidone or Risperdal has been that lifeline. Risperidone is one of the most commonly prescribed psychiatric medications in the world. It's part of the atypical antipsychotic family, but its uses go far beyond psychotic symptoms. I'm Dr. David Danish, a double board certified psychiatrist specializing in treatment-resistant conditions across child, adolescent, and adult ages. I've prescribed Risperidone to thousands of patients in the past, and earlier in my career, I used it much more often than I do now. These days, I still reach for it in certain urgent or severe cases, but I'm more cautious, especially with pediatric patients or those at risk for certain side effects. Today, I'll walk you through what Risperidone really does, who it tends to help the most, and what I think every patient and family should know before starting it. Let me explain what Risperidone is supposed to do. Risperidone works by calming two key systems in the brain, dopamine and serotonin. It helps reduce agitation, stabilize mood swings, and quiet psychotic thoughts. FDA says yes to schizophrenia in teens and adults, acute manic episodes in bipolar I disorder, and irritability in children with autism. Clinically, we also use it off-label for things like severe mood swings, such as in intermittent explosive disorder or disruptive mood dysregulation disorder, aggression and conduct disorder, treatment-resistant OCD, usually as an add-on medication, as well as treatment-resistant tic disorder. Most people feel something within the first day or two, especially when used for explosive or anger. But full benefits can take a few weeks to fully kick in. Here are the side effects I think you should know about. The three side effects I see most often in real life: weight gain. This is a pretty big one, especially in kids. Appetite goes up and weight often follows, and there's likely some metabolic slowing as well. It can cause sedation or drowsiness in some people, but not as much as its sister medications like Seroquel or Zyprexa. Now, the one I really worry about a lot is a bump in a hormone called prolactin, and that can lead to, in males, something called gynecomastia or male breast development. And in females, it can lead to menstrual irregularities as well as milk letdown from the breast area. Now, the other big long-term side effect, which I don't see as much because it tends to occur in older adults, but it's still a very real risk regardless of age with Risperidone, is tardive dyskinesia. And that is a movement disorder that tends to be permanent if it does occur. Now, this is rare. It tends to be more common in people who've been on higher doses for years, usually decades, usually more common in elderly women, but it's still a risk I discuss with all of my patients. And I go into a deep dive on this in another YouTube video, and I'll make sure to link that in the description. If you want the full list of the pros and cons and what to do about them, I'll make sure to give you the link to my Mind Vault resource at drdaviddanish.com, and it covers everything in plain English, and it's a free resource. So here's my take as a psychiatrist who prescribed Risperdal quite a bit in the past. Risperidone can be life-changing when used right. I see the biggest wins in children with daily rages from disruptive mood dysregulation disorder or autism that have failed all other treatment options. I tend not to use it in males at all if possible. In female patients who have bipolar I and extreme mania, Risperidone is the strongest treatment for mania that we know, stronger than lithium even. But this is not a casual medication. I start low, go slow, and monitor closely, especially in prolactin levels and weight. Now, in females, I may not actually follow the prolactin levels because as they go up, there's really not much you can do other than stop the medication. That said, the one thing I often will provide is a vitamin B6 supplement to help reduce that prolactin increase. And I'll make sure to put more information about that in the notes. Now, I want to summarize that Risperidone is one of the strongest, most powerful medications for intense anger, mania, manic symptoms, as well as psychotic symptoms. But it comes with significant side effect potential, which is why it needs to be used with caution. Also in the Mind Vault, I will supply you with a free checklist for tardive dyskinesia, that movement disorder I mentioned, so you can catch early warning signs and then talk to your practitioner with confidence and make sure you make the change before it sticks. Similar deep dives on nearly every psychiatric medication exist in the Mind Vault, as well as bonus tools for families on ADHD screening, bipolar screening, supplement guides for sleep, anxiety, mood swings, depression, and more. And hey, if you know someone starting risperidone or a medication like that, please share this video. Sometimes just understanding what's happening can make all the difference.